everyone, and welcome back to English with Sarah. In today's episode, we're going to talk about medical situations, especially what happens when you visit a clinic or hospital and talk to a doctor. These are real life situations, and knowing the right words can help you feel calmer and more confident. So let's begin. When you're not feeling well, you may decide to see a doctor. To see a doctor means to visit a medical professional to get advice or treatment for your health problem. You might go to a clinic, which is a small medical center, or a hospital, a large place that provides more serious medical care. When you arrive, the first person you usually meet is the receptionist. A receptionist is the person you see, and he or she welcomes the patients and helps with the paperwork. They may ask you to fill out a form, meaning to write down your personal information, symptoms, and medical history. After that, you may be asked to take a seat in the waiting room. The waiting room is the area where patients sit until it's their turn to see the doctor. When it is your turn, a nurse will call your name. A nurse is a healthcare professional who assists doctors and takes care of patients. The nurse might check your vital signs. Vital signs are basic health measurements such as temperature, blood pressure, and heart rate. They may also ask about your symptoms, which are the physical feelings or problems you are experiencing, like pain, fever, or dizziness. Next, you will see the doctor. The doctor will ask questions like, what seems to be the problem? This is your chance to describe your condition, which means explaining how you feel and when the problem started. The doctor may examine you. To examine means to look at or touch parts of your body to understand what is wrong. Sometimes the doctor will run some tests. To run tests means to perform medical checks, such as blood tests or x-rays to get more information. After that, the doctor makes a diagnosis. A diagnosis is the identification of the illness or condition you have. Once the diagnosis is made, the doctor will recommend treatment, meaning they suggest how to take care of the problem. You might receive a prescription. A prescription is an official note from the doctor that allows you to buy specific medicine from a pharmacy. The doctor will also explain the dosage, which is how much medicine you should take and how often. In some cases, the doctor may suggest rest, physical therapy, or even hospitalization. Hospitalization means staying in the hospital for further care and observation. If you are admitted to the hospital, you will stay in a ward or a private room. A ward is a large room where several patients stay together. During your stay, medical staff will monitor your condition, which means they regularly check your health to see if it is improving. Finally, when you are well enough, you will be discharged. To be discharged means you are officially allowed to leave the hospital. The doctor may give you follow-up instructions, which are steps you should take after leaving, such as taking medication or returning for another visit. And that's the end of today's episode. Medical situations can feel stressful, but learning these expressions helps you communicate clearly and take better care of yourself. Thank you for watching English with Sarah. Keep learning, stay healthy, and I'll see you in the next episode.